Aloha everyone, and thank you for joining the COVID-19 Public Health Action webinar, Understanding the Safe Access Oahu Program. My name is Makamai Namahoe, and I am the Public Health Programs Associate. Before we get started, there are some Zoom housekeeping to go over. Next slide, please. For all questions, please utilize the chat box or question and answers box located at the bottom of your screen. No continuing education credits will be provided during this webinar series, and all webinars will be available on the Hawaii Public Health Training Hui's YouTube channel. Without further ado, I would like to introduce our presenters for today. Our first presenter is Dr. Sandra Chang, who is a professor in the Department of Tropical Medicine, Medical Microbiology, and Pharmacology at John A. Burns School of Medicine at the University of Hawaii. A native of Hawaii, Dr. Chang completed her BS and MS degrees at UH Manoa. She obtained a doctorate in microbiology and immunology, sorry if I'm mispronouncing that, from Oregon Health Science University in Portland, Oregon, and did her postdoctoral training at California Institute of Technology. Dr. Chang joined the Department of Tropical Medicine in 1986, where she has been involved in immunology and vaccine development research and teaching in immunology and medical microbiology for medical and graduate students. She has served as a research mentor for undergraduate and graduate students. Dr. Chang is the chairperson of the UH Tropical Medical Graduate Program, co-chairs the Hawaii Department of Health's COVID-19 Vaccine Medical Advisory Working Group, and is on the leadership team to develop an interdisciplinary One Health certificate program at UH Manoa. Our second speaker is Dr. Catherine Perkle, who is an associate professor in the Office of Public Health Studies at the University of Hawaii at Manoa. Her research focuses on women's health across the lifespan, with research projects in several countries across North and South America, as well as in Europe. She is also the principal investigator for the Healthy Hawaii Initiative's evaluation team, which provides external evaluation services in health promotion and chronic disease prevention to the Hawaii Department of Health. During the COVID-19 pandemic, she has applied her expertise in chronic disease prevention and women's health to inform discussions and policy on the risks of COVID-19 to vulnerable populations, such as pregnant women and racial and ethnic minorities. And our third speaker is Amy Asobai, who is the Executive Director at the Office of Economic Revitalization. Amy Asobai has led teams, created policies, and drafted meaningful legislation at the executive level of state and county government, as well as with Hawaii's senior member of the U.S. House of Representatives. She has a deep understanding of strategic planning, building partnerships with community groups and nonprofits, mentoring staff, and coordinating communications outreach, external relations, and advocacy. So without further ado, I'd like to turn it over to Dr. Chang.
Hi, everyone. I'm going to be pulling up my presentation. Okay, so hopefully you can see it. I'm going to be spending a little bit of time at the beginning here talking to you about SARS-CoV-2 variants and the potential need for booster doses in the community. This is, I guess, one of the hot topics for vaccines right now. And looking back at the effectiveness of vaccines when they were first developed, you can see here the efficacy for both the Moderna and the Pfizer vaccines were extremely high. About 94% for Moderna and 95% for Pfizer in terms of preventing infection. And back then, we're looking at a picture of about 73 million infections and 1.6 million deaths in the world. Today, in August 2021, it has expanded to 217 million infections, as well as over 4.5 million deaths. So COVID-19 is very much still with us. And so in the next slide, though, the good news is that the vaccines are still very effective in preventing against severe disease or hospitalization. And so this is national US data on hospitalization rates among adults between January 2021 and the beginning of July 2021. And as you can see in the various age groups, whether you look at young adults on the left, 50 to 64-year-olds, or the elderly over 65-year-olds on the right, we can see that the incidence of COVID-19 hospitalization rates are much higher for individuals who have not been vaccinated, that's shown in the blue, as compared to individuals who have been fully vaccinated. And it ranges from 13 times higher in the elderly over 65 years to about 24 times higher in individuals 18 to 49 years. So definitely, there is still a tremendous benefit of vaccination in the community even today. However, we're now being troubled by these variants that have emerged of SARS-CoV-2. And just to give you just a little review, going back to high school science, this virus is an RNA virus that has a genome encoding about 29 proteins. The one that we're most interested in is the spike protein. And this is the protein that is responsible for invasion of host cells. And this is how the virus actually gets in and causes an infection. And that is, the spike protein is the target of vaccination. And so when we talk about the impact of mutations, we're very interested in changes that occur in the spike protein gene. And so as far as how the variants arise, every time a virus replicates, there is an opportunity for mutations or errors to occur in its genetic material. Most of these changes have no impact or are actually harmful to the virus, but on rare occasions, a change can give the virus an advantage, leading to variants of interest as well as variants of concern. Specifically, we're worried right now about the Delta variant. And for these variants that can cause a viral advantage, it can allow it to spread more easily, as we've seen that the Delta variant is twice as transmissible as the original SARS-CoV-2 virus. And in addition, it can give it an ability to produce more severe disease. The jury is still out as to whether the Delta causes more severe disease itself or whether it just causes more cases, and by virtue of causing more cases, causes more severe disease. And so where are we in terms of variants in the community? This is the picture of the prevalence of a variety of different variants in the community. And in orange, we can track the spread of the Delta virus, the Delta variant, from back in May to the current time. And as you can see, the vast majority of infections are currently being caused by the Delta variant in the US. And so now, this is the picture in Hawaii. And similarly, in August, we see almost 100% of infections being caused by the Delta variant in Hawaii. So we are very concerned about the impact of the Delta variant on both the transmission of disease and also the effectiveness of our vaccines. And so when we look at effectiveness against infection, there were 5 studies, independent studies that were done looking at infection from about the time of introduction of the vaccines until the current time. And so if we look at the data, we can see that, for some of these studies, vaccine effectiveness in terms of preventing infection has held pretty steady until quite recently. And we've seen somewhat of a decline depending on the population. There may be quite a dramatic decline down to about 40%. And then in other studies, only to about 80% in terms of the effectiveness against infection. Coincidentally, this drop that we're seeing in terms of vaccine effectiveness against infection coincides with the emergence and spread of the Delta variant. going from about 7% of infections back in May to about 94% of infections nationally in July. Now, we need to also look at not just infection, but also hospitalization or severe disease. And that's a very important comparison, because we've been talking on the left about infection or just the production of symptomatic COVID-19. And clearly, there has been a reduction when we look at pre-Delta versus Delta infections. However, if we compare the effect of Delta on hospitalization or severe disease, we can see that it is still quite effective. Again, the vaccines are still quite effective against severe disease and hospitalization. So ranging from about 75% effective to 95% effective. And this is where the controversy lies for the recommendation for booster shots. Are we really talking about trying to prevent infection, or are we more concerned about preventing severe disease and hospitalization? Okay, so that just highlights the importance of preventing hospitalization and severe disease by vaccination. Okay, so when we've been talking about booster doses and additional doses, there really are two uses. And the first is for individuals who have not made a very good response against the primary vaccine series. And this is immunocompromised individuals. Okay, so recently the FDA did approve additional doses for individuals who are severely immunocompromised. However, more recently, the FDA is reviewing data for the use of booster doses or an additional dose being used for individuals whose primary vaccination series is likely to have waned over time or declined over time. And so that is what we're talking about right now, the use of booster doses in the general population. And so if we look at the vaccination of the US population, we can see that when we first started, we focused on very high-risk populations, including nursing home individuals. So these are individuals over 65 years old and above. And as you can see, those were the first to receive vaccinations. And we've pretty much maximized our vaccination of that population. And more recently, we've been vaccinating younger age groups, and most recently, the 12 to 17-year-old adolescent population. But there is concern that the individuals that were vaccinated early, that is, the high-risk populations in occupations such as physicians and practitioners and nurses that are caring for the COVID-19 population, they were vaccinated early, as well as the elderly. Okay, and if we look at the effectiveness against hospitalization, we can see that there is a difference if you look at age groups. Particularly if you look at individuals 75 years and above, this is where you see the greatest decline in effectiveness against hospitalization. The rest of the populations between 18 and 74 years of age have held steady in terms of vaccine effectiveness against hospitalization. And so scientists like to point out that it is not uncommon for a vaccine series to require multiple doses. And so if we look at the hepatitis B vaccine as well as the HPV vaccine, we do administer a third dose approximately 6 months after the second dose. And so it is not surprising that we are considering the need for a third dose for this particular vaccine. However, it doesn't mean that annual boosters are going to be needed for the COVID-19 vaccine. And so the figure on the bottom just looks at the science behind the use of this third dose of a vaccine. And it allows really an expansion of the protective mechanisms involved in protecting you against infection, including the boost or increase in the level of antibodies, as well as B cells and T cells that participate in the immune response against the vaccine. And so in summary, the COVID-19 vaccines continue to maintain very high protection against severe disease, hospitalization, and death. However, in recent months, it looks like protection against infection, including asymptomatic infection or mild infection, has declined in recent months. It's difficult to distinguish the role of time since the primary series, as well from the impact of the Delta variant. However, it remains a top priority to vaccinate unvaccinated individuals in the community. And the priority for booster doses should be to protect individuals at high risk of severe disease. So right now, we're awaiting additional safety data and regulatory allowance for the use of booster doses in the general community. On September 17th, the FDA is meeting to consider the use of booster doses and what the data looks like for the efficacy of booster doses in the general community. Okay, so that is the end of my presentation. And for more information, please contact me if you have questions, or there are a number of different resources, different websites. Get Vaccine Answers is really great for providing vaccination education to the community. And then, of course, the state and the city and county, as well as the CDC, has very good resources for vaccine information. Thank you.
Great. Thank you, Dr. Chang, for that medical background on the vaccine as well as the Delta variant. I would like to pass it over to Dr. Perkle.
I'll just get my screen up. So I wanted to say thank you first and foremost, and deeply appreciated the introduction and the opportunity to present with such exceptional co-panelists. So I was asked to talk a bit about the public health response to COVID-19 as it is surging currently in our community. So where I'm going to start here is first by highlighting or reiterating why it is so critically important for us to urgently slow the spread of COVID-19. So there are a number of medical and humanitarian reasons why we would like to slow the spread of COVID-19 in our communities. On the left, I've put a quote from the Nobel laureate Amartya Sen, and it says, "Health is among the most important conditions of human life and a critically significant constituent of human capabilities, which we have reason to value." And what he's highlighting here is that good health is a prerequisite for many other pursuits that we hold dear in life. So this is one reason amongst many that we would like to slow the spread of COVID-19. Of course, we want to prevent premature mortality, and we want to protect vulnerable populations such as our kupuna. The other thing, another couple of reasons, is that we actually have, despite the fact it feels like forever that we've been in this pandemic, we've really only been in it 18 or 19 months. So we don't have long-term data on the effects of COVID-19 illness. And because up until very recently, there were so few cases in children, we have limited pediatric data, which is becoming more of a concern as we're seeing large outbreaks in school-age children. But one of the major reasons and one of the most urgent reasons why we need to slow the spread of COVID-19 is our health system crisis. And this is what we're seeing play out right now in our community. So probably all of you have already seen these slides or versions of these slides where we talk about flattening the curve. And that's because we recognize that our health system has a finite capacity. And when we have large surges of patients like we're experiencing right now, that number far surpasses our capacity to manage these cases. And when we have such sustained and intense pressure on our health systems, there are acute and long-term consequences. So the short-term or acute consequences that we have, we're already seeing in the news media regularly these days. We have shortages of ICU beds, of ventilators, oxygen, medications, PPE. We also have to oftentimes redistribute personnel who might be working on other health conditions of importance and or equipment or infrastructure in order to handle these surges. And all of this can lead to compromised quality of care and preventable deaths amongst people who are ill, whether it's with COVID-19 or other conditions that go unaddressed due to the surges. Long-term, when you have sustained pressure on your health system, like what we're experiencing right now, this can lead to health professional burnout. And this entails very intense psychological harms to many of our healthcare workforce, as well as issues around, again, long-term consequences to our quality of care as healthcare professionals manage their burnout. And at the worst, people may decide to leave their professions. They may decide to quit being nurses, doctors, medical aides, etc. And when that happens, that actually undermines our existing healthcare workforce and makes us more vulnerable to future crises. There's also economic and staffing ramifications. COVID-19 is not cheap to treat. And with this many patients and this many patients needing intense care, this can be very expensive for healthcare systems to manage. And yes, we've had significant amounts of federal and state support to help keep our healthcare systems afloat. But if we aren't able to address the costs associated with care, this can entail, for example, higher prices to patients and insurance companies, and even the cutting of staff in order to save money. And when things get really, really bad, then health system collapse is a concern. And we've seen globally numerous instances of health system collapse. So here I've put a newspaper article from Reuters about health system collapse in Brazil. This was one of the more publicized cases across Brazil. Various health systems collapsed during the third wave of their pandemic that happened in spring of this year. There were numerous adverse outcomes associated with the intense pressure on their healthcare system. I'm highlighting one. We've seen, and this has been well documented in the literature, a 50 to 100% increase in maternal mortality associated with COVID-19 in Brazil. And this was not due to simply having patients with pregnant women with COVID-19. A lot of these excess deaths are because pregnant women, when they needed care, could not receive it due to the health system being under such intense pressure. So all of that is in the abstract of why we really need to address the crisis that we're facing right now and curb or reduce the number of cases. But I wanted to make this a little bit more real. I wanted to highlight what it's like for a healthcare provider to experience such intense pressure on the health system. So what I have here is a quote from a colleague and friend. She's a healthcare provider in Northeast Brazil. And this is how she was describing the last surge. During the pandemic, there were some times in which it seemed we were living in a scenario of war. The hospitals were so beyond their capacities that they decided to close the doors of the emergency rooms because they had no place for further patients. In the Amazonas state, more than 30 people died because of a shortage of oxygen. Even those with private health insurance were struggling to find proper health assistance. Of note, in Brazil, less than 25% of the population has access to private health insurance. My sister's friend was one of them. When she needed medical assistance because of COVID, all private hospitals were full, and she ended up in a crowded public emergency care unit. Some days later, she was admitted in a temporary hospital from the state government that was implemented only to treat patients with COVID. During the whole time, her friends, including my sister and I, were trying to find a place in a private hospital for her because the state hospital was struggling with a lack of medications and infrastructure. Only after several days was she transferred to a private hospital, but she was already too ill at that point. Unfortunately, she died a couple days later, and we question if this would have been different had she received proper assistance from the beginning. So this is what we're trying to avoid, and we can. We have a variety of pharmacological and non-pharmacological strategies that can help us reduce the amount of COVID-19 that is being spread in our communities. So first and foremost, as was already presented by Dr. Chang and will be reiterated later by Amy Asselby, vaccination is the most important tool that we have available for us. But there's also a number of other tools available. So one of the tools that we're going to talk about today is the Safe Access Oahu program. And this is the policy that requires all employees, contractors, and volunteers of businesses such as restaurants and gyms to show proof of full vaccination against COVID-19 or a negative COVID-19 test result. So the Safe Access Oahu program is part of a series of policies that we see globally in places like Europe, in Canada, and nationally in various jurisdictions across the United States that are largely pulled under the group of vaccine and/or test passes. So one of the rationale for putting in place these vaccine or test passes is epidemiological. Until we had widespread vaccine access and or testing capabilities, we really didn't have a verifiable means to stratify the population according to their risk of hospitalization or death. And so we were obligated to put in restrictions that apply to entire jurisdictions or countries. But now that we have vaccines that are widely available, at least in upper income countries, and tests that are pretty widely available as well, we can take a more targeted approach that puts restrictions in place based on risk. So as it was already shown, vaccinated individuals are much less likely to be hospitalized and therefore strain our health system. One of the other justifications that we hear for these types of vaccine or test passes, and this is probably what most people have heard, is that they offer a safer means to return to normality, to return to a sense of security when doing routine activities, and potentially to stimulate the economy. With regard to the latter, in terms of stimulating the economy, there is some anecdotal evidence coming out of Europe that this might be the case. But this really is dependent on the level of vaccination in the community. The higher the vaccine levels, the more likely that people will use these passes and help stimulate the economy. And a third justification for these vaccine or test pass has to do with incentivizing vaccination. So again, in Europe, we saw once Italy put in place their version of a vaccine pass, demand for vaccination increased by 200% in some regions. And in France, after implementation of their version, 5 million folks got their first dose and 6 million their second dose within the first 2 weeks of the policy being put in place. And that was after weeks of waning interest in vaccination in France. So there's a lot of potential for these vaccine and test passes, but there's still some other considerations that need to be taken into account, such as the fact that vaccination does not fully prevent infection or onward transmission to other individuals. And there are still some important ethical and data security concerns. That being said, this is an important tool in our toolkit, but it is not the sole solution that we have. So we need to complement policies like the Safe Oahu program with other important tools that help us protect against infection and illness. So I'm going to go through a handful of these. I won't go through all of them. Probably one of the most important non-pharmacological tools we have is the use of masks. And that's because masks protect those around you in case you're infected, and they can offer some protection to you as well. And there is a lot of data out there showing that masks are effective at reducing or at controlling community spread of COVID-19, of the virus that causes COVID-19. Here is an abbreviated table of a variety of studies showing precisely this, that masks are effective. So one thing that we really do need to keep in mind is the importance of indoor mask mandates. And this is again because they're a low-cost, non-pharmacological intervention with high benefit. They're especially important indoors and when social distancing is not possible. And the more mask wearing there is in a community, the larger the benefit to each individual member. Another tool we have in our toolkit is with regards to ventilation. So we've seen a variety of newspaper articles in the last couple of weeks. Recently, there's been a series of clusters that were attributed to poorly ventilated restaurant kitchens. And that's because indoor transmission is a major concern when it comes to the virus that causes COVID-19. And that's because viral particles are more concentrated indoors than outdoors. So there are mitigation strategies we can use to reduce the particle concentration and make it less likely that those particles will be inhaled and thus infect somebody. So I've put here just a handful of these mitigation strategies. These come from the CDC. The link at the bottom can bring you to a comprehensive list of these strategies. And they basically entail increasing the amount of ventilation in a space, getting more outdoor air indoors. And then the other thing we can do is increase the use of outdoor spaces and getting people outdoors. And when we focus on ventilations, there's other benefits that go well beyond COVID-19. For example, improved occupational health for workers. Restaurant workers, especially in tight, in poorly ventilated areas, are exposed to a variety of volatile organic compounds that can compromise their health in the long term. So improving ventilation goes beyond just COVID-19 for them. We can also reduce the risk of other airborne infections to people in those indoor environments. And for me, of particular interest is that when we focus on our outdoor environments, we can actually build better, more sustainable urban environments. So I'm going to give you an example here. These images come from what's known as the Pedestrian Mall in St. John's, Newfoundland, which is in Canada. This is not a part of the world that's well known for its good weather. But because of COVID-19, the city officials there decided that they would shut down one of their major streets in downtown and turn it into an outdoor area for folks to use to recreate and to shop. And so far, so this was directly in response to COVID-19. And so far, it's been shown to be a success. Here are some other examples of how we can better use our outdoor environments and to encourage people to get into safer places where they can recreate and shop. So there are a number of other strategies that we can use to reduce contact between people and also reduce risk of infection. I've listed some here. We've all lived through these now, but these are other tools that we also have in our toolbox. So I'm going to finish by highlighting the need to balance risks. And so that is, we've got a lot of tools in our toolkits that help us mitigate or reduce the risks that are around us. And we need to use them when we are thinking about different activities that might increase risk elsewhere. So for example, we may have social priorities such as the need to open up in-person schooling or to encourage tourism to our islands, but these increase risk. So when we do that, we need to balance this out by maintaining other strategies that reduce risk in the community elsewhere, such as mask mandates. And the reality is now with the Delta variant, it is very unlikely we're going to achieve herd immunity without near universal vaccination. So that means that the complete removal of restrictions is unlikely advisable in the near future. So just to finish with a cautionary tale, this article came out last week in the New England Journal of Medicine, and it was a look at COVID-19 amongst a highly vaccinated health system workforce in California. And they saw consistent and very much in line with what Dr. Chang just showed, a spike in infections amongst this very valuable workforce right now, starting in June. And the authors attributed this to the Delta variant and waning immunity over time. So if we think of our balance, these are increased risks. But at the same time as this was happening, the state of California ended all of their masking requirements. So that one tool that was out there to help limit other risks in the community was also removed. And that tipped the balance in a way that was very adverse for these healthcare professionals. And that's what we're trying to avoid. So I would end by saying that as we think about our public health responses moving forward, we have to really think about that fine balance. What do we prioritize in our communities? And where can we continue to put our mitigation strategies so that we can have those things that we value most in our communities. So mahalo to all of you guys, and I hope everybody stays safe.
Great. Thank you, Dr. Perkle, for that wonderful presentation. Let's pass it along to Amy to close us out.
Thanks Makamai for the introduction, and thank you also to Dr. Perkle and Dr. Chang for everything you added. I really think it helps to build and share the evidence, the science, and the health case for why Mayor Blangiardi has decided to introduce safe access to Oahu. My name is Amy Osselby. I'm the Executive Director of the city's Office of Economic Revitalization. And through this webinar, another one we had yesterday, and additional outreach that our team is doing at the city, we really hope to educate the community and the businesses that are impacted by the Safe Access Oahu program. Next slide, please. So today, I'm going to focus my remarks on information that can help you as a community member or as a business person to better understand, number one, Safe Access Oahu, and then how it impacts employees and customers, and of course, the requirements for businesses. Next slide, please. As has been repeated in the remarks of my two previous speakers, vaccinations are our #1 weapon against COVID. And of course, our goal at the city is to get as many people fully vaccinated as possible. Currently, 66% of our population on Oahu is fully vaccinated, and 72% have received at least one dose. Many businesses also agree that full vaccination will help get us out of this crisis. A recent survey coming from the end of August shows that about 900 local businesses surveyed by the University of Hawaii showed more than 80% of those businesses surveyed reporting that most of their employees have already been fully vaccinated. Another 65% of those businesses surveyed said that they are already or will likely require employees to be vaccinated. So the Safe Access Oahu program will definitely help businesses to create those safe spaces for both their employees and customers. Next slide, please. So to start off, our first educational section is for employees at establishments impacted by Safe Access Oahu. Safe Access Oahu starts on Monday, September 13th. That's next Monday, and it's scheduled to be in place through October 30th. The city intends to vigilantly monitor and, of course, evaluate what happens through the course of Safe Access Oahu being implemented, and then make future decisions based on those learnings. Safe Access Oahu will require full vaccination for employees, contractors, and volunteers at entertainment, recreational settings, restaurants and bars, and fitness establishments and group physical activities. Safe Access Oahu does not apply to establishments that offer takeout services only. Next slide, please. Safe Access Oahu requires that individual employees show proof of full vaccination, which is completed. So that means a completed vaccine regimen approved by the Hawaii State Department of Health. Employees can provide a couple different ways of showing that they were vaccinated. They could use a hard copy of their vaccination card. They could share a picture of their vaccination card, or they could share a Hawaii State approved digital or smart device app that confirms their full vaccination status. And while our webinar was ongoing, the governor at the same time was announcing his smart health card, which will allow individuals to upload their vaccine card, get it verified by the state of Hawaii, and you could use that tool to show that you have been vaccinated when you enter one of the Safe Access Oahu businesses. Next slide, please. So here are a number of examples of acceptable proof of vaccination. From left to right, we have a CDC COVID-19 vaccination card. Then you can see a State of Hawaii Safe Travels app. The next one is a VAMS report from the State of Hawaii Department of Health. And finally, on the far left is a Hawaii State Department of Health vaccine record. Next slide, please. So to support businesses and their employees, this program is flexible. It has a testing alternative. So workers who aren't fully vaccinated, yes, will have to provide proof of a negative COVID test once a week. And that is a test approved by the Food and Drug Administration. Employees must also provide identification with the same information as the proof of vaccination or proof of negative COVID test. So FDA approved COVID tests can also include those home tests purchased at pharmacies. Those are the ones that say FDA emergency use authorization only. So FDA EUA approved tests. Next slide, please. So The identification that you would need to provide in coordination with your proof of vaccination could be any ID that includes your name and photo or includes your name and date of birth. So that might be a driver's license, a non-driver government ID card. You know, here we have state ID cards. It could include a passport or a school or work ID card. Next slide, please. So businesses may also have vendors, suppliers, or other individuals who are occasionally or regularly on the premises of their establishment. A business does not need to check proof of vaccination for individuals in these cases. Number one, if the vendor or supplier is on premises for less than 15 minutes, if an individual is making a delivery or pickup for less than 15 minutes, or if an individual is making a repair that can be completed in less than 15 minutes. In all cases, please keep in mind that any of these individuals, the person who's picking up or the vendor or supplier or repair person, they must still wear a mask. Our next section, next slide, please, deals with customers going to an establishment covered by Safe Access Oahu. So Safe Access Oahu will require vaccination for customers at entertainment and recreational settings, restaurants and bars, fitness establishments, and group physical activities. It does not apply, this is a reminder again, to establishments that offer takeout service only. Next slide. This is a reiteration, the same that applied for employees. Next slide, please. For the same types of acceptable proof of vaccination. I'm not sure how these slides are slightly different from what I have, but I'm going back. The types of acceptable proof of vaccination are the same for customers as they are for employees. The CDC vaccination card, a State of Hawaii Safe Travels app, a VAMS report, or the State of Hawaii health vaccination record. Alternative proof of a negative COVID test. This is an option for customers who are not fully vaccinated and they do not have that acceptable proof of full vaccination. So they have the option of sharing a negative COVID test. The customers that share that negative COVID test must have taken that test within the last 48 hours. And a customer must also provide identification with that same information as the proof of vaccination or proof of the negative COVID. Again, same situation applies. All the COVID tests must be FDA approved, and those that are available at our local pharmacies must be FDA emergency use authorization approved also. Next slide, please. Proof of identification. Same as what I mentioned before for employees. In addition to the vaccination proof or negative test proof, ID must either contain name and photo or name and date of birth. Again, driver's license, non-government ID, passport, or school or work ID are acceptable. Customers who are not fully vaccinated or do not have acceptable proof of vaccination have the option of providing that negative COVID test. All right, we're often asked if this vaccine or testing requirement applies to customers who are getting takeout at a restaurant. So just a reminder, again, if a customer is only going to be on the premises for 15 minutes or less, the business does not need to check for proof of vaccination for those picking up food or for takeout or delivery. Individuals picking up that takeout, of course, must still wear a mask. Next slide, please. So our final education section about Safe Access Oahu is on the requirements for businesses. Next slide, please. Businesses included in the Safe Access Oahu program will have to self-certify that they meet the Safe Access Oahu requirements. And you can find that information at oneoahu.org/test-attestation. Companies will have to post highly visible signage that they are participating in the program. And the businesses can download that sign at oneoahu.org/safe-access-Oahu. You can also see an example of the sign that you can download right here on this screen. It is fine if businesses want to make up their own sign to post, that works too. But businesses must also develop and keep a written record of their protocol for implementing and enforcing safe access Oahu. Just like businesses implement other government programs, like those that establish maximum occupancy or other signage that we regularly see when we go out to a business. Establishments may need to make their policy available if city officials request to see it. And businesses that don't meet the requirements of Safe Access Oahu, they could be cited, fined, or the Liquor Commission does have the authority to shut down non-compliant bars and restaurants. And finally, to quickly wrap this up, I'd just like to share a few resources because we know that local companies want to take positive action to protect their employees and customers, but they need information and education to do so. We know and we've heard that some businesses have already put vaccination policies in place, and we've seen that in some cases their customers have increased because people want to visit safe places. Other businesses, workers, and customers are already getting ready for Safe Access Oahu, and one gym owner told us that he was starting a database of his customers to just really help streamline the process. And finally, all this information that I've shared and other tools are available at oneoahu.org/Safe Access Oahu. The FAQ is regularly updated with questions from businesses and the community. Everything in my presentation is at that site. And we also want to make sure that people know that our vaccination sites are regularly updated. If you go to that link at oneoahu.org/find-vaccine, as well as an extensive map of current COVID testing sites, oneoahu.org/COVID-19-testing. And we're continuing to add more resources to that site, and the Safe Access Oahu implementation and other information will just continually be updated with questions that we receive at our 768 City Call Center and those that we get from webinars like the one we're participating in today. So thanks for the opportunity to share more about Safe Access Oahu.
Great, thank you, Amy. That was wonderful. So we have a couple questions that kind of came in. I would like to ask the speakers. The first one we have is for Amy. Are there medical or religious exemptions for the Safe Access Oahu program?
The exemptions are one, the test. Instead of showing a vaccination card, you are allowed to provide a test. The other exemption is for those who are 11 years old and under because they can't get a vaccination. And then finally, there is an exemption for pickup at restaurants and bars that are doing takeout only. There is no medical or religious exemption because testing is an alternative in this program.
And then a follow-up to that, does the Safe Access program apply to other retail and business establishments or only recreational establishments? If not, are similar rules being proposed for other businesses such as salons or grocery stores at the moment?
No, grocery stores, hair and nail salons are not included in the mayor's emergency order. It is only bars, restaurant, entertainment, and fitness or other recreational facilities right now.
Okay. We have another question. I think either Dr. Chang or Dr. Perkle can answer. We continued our mask mandate, but we still saw the spike in the Delta variant. Is this because of an increase in travel by outsiders or just the community letting down their guard in the last few months?
I can start and then pass it off to Dr. Chang. So I think the first part about this and what I think Dr. Chang can speak to more authoritatively than I can is just how infectious this Delta variant is. So The first thing I'm going to say is I'm not going to have a satisfactory answer for the person who posed the question. The reality is figuring out what is that tipping point when you have multiple causes is really, really challenging, right? So it's not just tourists mass mandate vaccination, right? It's tourist mass mandate vaccination, how people interact with each other, physical capacity limits, whether people are getting together in big groups or not. All of these factors come into play. So what I will say, though, is yes, it is true. We were one of the few states that maintained our indoor mask mandates, which was good policy. But we opened up everything else essentially at the same time, including tourism. And this happened around the same time that the Delta variant was picking up pace in our communities. So we did keep one very important mitigation strategy in place, but we eliminated almost everything else. And we did this at a time where there was this variant that was coming out that we didn't know as much about, that has turned out to be really, really infectious. So I'll stop there to let Dr. Chang maybe discuss a little bit about just about the Delta variant and perhaps other variants of concern.
Thanks, Catherine. I agree with what Catherine has already told you, but in addition, it's clear that transmission is within the community. It's not due to our visitors who are here. I mean, there is so much community-based transmission right now. If you look at the clusters, really it is, large gatherings, restaurants, bars, et cetera, where people are not wearing masks. So I would say, I would look within the community for transmission, not anywhere else. In terms of the mask mandates, I think they're really important. Also very important is distancing. The mask is not going to protect you 100%. You have to maintain 6 feet distancing from other people, and you cannot congregate in large numbers. And I think that's the bottom line. In terms of, other than vaccination, the combination of masking, social distancing, and no congregating of people, particularly with people that are not within your bubble. I mean, those are the factors that are going to control Delta, and we're really not enforcing those, and we're not observing those in our community sufficiently right now.
Thank you. You make such a good point. It is the distancing. I think everyone thinks that when you're masked, that you can just be around one another, but really maintaining that 6 feet of distance can help protect ourselves from one another. Amy, we had a question for you. Why is the Liquor Commission the entity responsible for shutting down restaurants, particularly those that don't serve alcohol? Are there other city and county entities taking on the task of reinforcement?
Yes, the HPD would be the enforcement entity for restaurants or, coffee shops or whatever that don't serve alcohol. The Liquor Commission only has enforcement authority over bars or restaurants that serve alcohol.
Awesome. One more question. Does the Safe Access program able to require online verified vaccination for people who have been vaccinated on the mainland?
I'm not sure I understand the question, but if you have a US vaccine card, you can use that to show, because it's a CDC card, right? So they're uniform across the country. Is that what the question is?
Mm-hmm. Yeah, like if those were vaccinated on the mainland, how would they?
Yeah. And of course, they can also, if they aren't vaccinated and someone travels here, they may also show a negative COVID test in the last 48 hours.
And to follow up, will places like the Convention Center or Blaisdell Center require vaccine-only patrons? Are you aware of that?
So neither are open for business right now. So if they did provide entertainment, I believe they would be covered, but since they're not operating, right, entertainment, recreational, like a movie theater, a museum, those kind of places, yes, are required to check the vaccination status of their customers.
Awesome. I mean, this one can be for all. I don't think it's really directed towards anyone. What are your thoughts of clinics coming in that provide medication for COVID patients before they have to go to the hospital? Dr. Chang, you're muted.
I think they may be referring to monoclonal antibody treatment of patients, and they are setting up, those centers for monoclonal antibody treatment. This is sort of a resort for individuals who are at very high risk of severe disease. And so if they have clear exposure, within their family or within their workplace to someone who has been infected, then they can see their physician and arrange to have access to these Regeneron monoclonal antibody treatments, either by infusion or by inoculation, by injection. So, but this is really, they need to see their medical provider for that.
Thank you. And I think we have maybe one that might be directed more towards you, Dr. Chang. The vaccines were developed at a time when restrictions were imposed in many places to limit the spread of the virus or the exposure to the virus. Had those preventative measures, such as staying at home, mask wearing, and social distancing, been calculated into the efficacy of the vaccines?
So I think it's a moving target, and that's been the problem. I mean, no one anticipated the impact of the Delta variant being so heavily transmissible. And so we did back away from some of the restrictions, and that probably allowed it to spread more rapidly. But I don't think anyone expected a variant like this to come by. So I don't know if that answers the question, but really it's really the emergence of new variants that are more transmissible that has created problems.
Dr. Burkle, do you have anything that you would like to add? Any thoughts on how the vaccine, all these preventative measures may have helped?
I think if I understand the question, it's whether or not the efficacy rates that were calculated took into account the restrictions that were put in place. And that is a very complicated question to respond to. The trials themselves, when you're doing a randomized trial, they're supposed to be isolating out the effect of the intervention. So in this case, the vaccine, over these other factors, which we would call confounders, or factors that we would that could confuse the results in one way or another. I would say that the efficacy rates that were calculated were pretty accurate at the time, and I would agree, especially since they were so consistently seen, especially since some of the trials involved multiple countries with very different interventions in those populations. So I would say, and I'm sure Dr. Chang actually knows much more about this than I do, but I don't think that the reason that the efficacy rates were so high was a result of the fact that these other restrictions were in place. But as Dr. Chang already alluded to, the Delta variant has really, really changed things dramatically. And unfortunately, the reality is that this, viruses mutate, that's what they do. And so it's likely we will see other variants of concern. We already have several of interest that people are paying attention to. So this is part of the reason why it is so critically important that people get vaccinated. The more people that are vaccinated, the less opportunities for mutations and the less opportunities for the development of scary new variants.
Great, thank you. I know we're coming around the 2 o'clock hour, so I want to respect everyone's time. I know we have a lot of questions coming in, but I would like to give our presenters maybe 1 or 2 minutes each. If you could give any last thoughts to our participants on the call. Dr. Chang, if you're unmuted first, sorry, I'm going to nominate you.
Okay, fine. So yeah, thank you to everyone for really listening to us and hearing what we have to say. I think it's really important that the community understands what is going on right now in terms of the COVID-19 pandemic. The vaccines continue to be a very powerful tool, but they're not a panacea. And we may or may not need boosters for the general population, but I think, as I mentioned at the very end, really it is critically important for everyone to get vaccinated who has not already been vaccinated. It will protect you against severe disease and death. I mean, there's no better reason than that. So please continue to get vaccinated.
Thank you. Dr. Perkle?
I would reiterate exactly what Dr. Chang said. Vaccination is our most important tool out there. It's really important that people get vaccinated, and this is, important locally as it is globally. And then, we do need to maintain other protections such as the physical distancing and, masks when indoors, et cetera. So we can't let our guard down now.
And then Amy, if you had a lasting thought for our participants on the call.
It's encouraging everyone to get vaccinated, number one. And then, of course, for questions about the Safe Access Oahu, please peruse the oneoahu.org Safe Access Oahu website. It has a ton of information. We keep adding to it, especially based on the questions that people have been sharing with us. And you may also call 768-CITY, and those folks are manning the call lines at the city call center to ask questions that businesses or customers may have about the program. So thanks for hosting the webinar, HIPHI. Really appreciate the opportunity to share more information with the community.
Yeah, and I want to thank you all for being our guests today, and thank you to all of you who joined us on Zoom for this webinar. And lastly, to thank our HIPHI staff who are working behind the scenes. Please save the date for next Wednesday, September 15th, for our next public health action webinar addressing how to have conversations about vaccinations or around vaccinations. Be safe, be well, and we hope to see you on our next webinar. Aloha, everyone.